So we're looking at the MODS, right? MODS meaning the multiple organ failure or multiple organ dysfunction, right? So if it's the MODS, of course, you are basically looking at the multiple organ dysfunction, but failure can also be used there instead of dysfunction. So of course, you just have to do with many organs that are losing their ability to function optimally. Okay, many organs losing their ability to function optimally. So for what we got here is also known as multiple organ failure. All right, multiple organ dysfunction syndrome is also known as what? Multiple organ failure. It's a life-threatening condition where two or more organs are failing to function properly. All right, so it's not one organ, two or more. All right, so often they are failing to function because maybe there's illness, maybe there's trauma, maybe there's infection. It's a medical emergency. Do you understand? So what is it? It's a progressive dysfunction of two or more organs where the body can't maintain homeostasis without medical support. All right. So it's often triggered by first heat. So something is usually triggering it. It could be sepsis, where infections are getting into the blood, spreading wide. Could be trauma, could be pancreatitis. Okay. Then a second heat, like maybe surgery or secondary infection, will now trigger it widely. So commonly affects organs like the lungs, the heart, the kidneys, the liver, the brain, the blood system. Causes: sepsis, most common cause. Traumas, inflammation of the pancreas, all right, severe infections, toxic injuries, heat stroke or eclampsia. All right. So these are the different systems of the body and how they will be affected. Okay, if there's a multiple organ damage, okay, or dysfunction syndrome. So different organs and what the different symptoms that might show up in this condition. So you have the lungs, we have the heart, we have the kidneys, have the liver, we have the brain, we have the blood. So just pause and look at the possible symptoms that might actually come up, all right, based on each organ. All right, so diagnosis is blood test because you want to actually what, check out how the liver is still functioning, check out how the kidneys are functioning. Then you do imaging to look at each of the organs to look at what the damages that occurred. All right, then sequential organ failure assessment. All right, then monitor vital signs and urine output. Treatment is such a person should be put in the intensive care unit of the hospital because they actually deserve first-hand care, one-on-one monitoring. All right, treat underlying causes. Then organ support, like if the person is having issues with breathing, you do mechanical ventilation. If the person is having issues with passing out urine, you do what? Dialysis. You understand? Vasopressors for blood pressure, extracorporeal, oxygen, nutrition and fluid management, prevent any secondary insult from coming in to complicate things, right? So that's it for the MODS.